Okay, so let's just talk about some key points of the first bath. Although it's totally up to the parents when your baby should be bathed, if circumstances require your baby to need an IV, your nurse will likely bathe your baby to minimize infection before they start that IV. So that's something to keep in mind. That's a total big if, right? As was previously mentioned, it's wise to wait at least 2 feedings to bathe your baby to be sure that breastfeeding is established. And this is why. The bath can really wear baby out, and the next feeding after the bath can often be a little bit more difficult because they're going to be tired. We also want to make sure that baby's blood sugar is doing well before we ice them out in the bath. Like we talked about with blood sugar, when the baby gets cold, you're going to use your energy stores to warm yourself up. So we want to make sure they've got some food in their bellies and they have the energy stores or the blood sugar to be able to warm themselves back up. And I'm kidding here. We don't totally ice them out, but they do drop their temperature because, like we talked about, newborns cannot thermoregulate. I put a question mark on using lotion on your infant. That's because everybody has a little difference of opinion on this. I think it's fine to use lotion. It makes them, smell great. There's certain lotions that I like better, and I mentioned that in the bath video. Something to keep in mind, though, is that's totally normal with your infant, is for the next week or two, their skin actually peels, and that's something that's normal. It's not usually dry skin, so you don't need to be worried about, they're not getting enough lotion or whatnot. Another recommendation is to only bathe your infant 2 to 3 times per week to also help not dry out the skin any further, especially depending on what climate you're in. It just kind of dries out their skin whenever they get a bath. So the other really key thing is to be sure to brush hair or scalp daily to minimize the risk of cradle cap. All right, just a few more special considerations. So for boys, you're going to want to avoid pulling back the uncircumcised skin. And then for girls, you might notice some discharge or vernix in their folds. You might even notice a little blood, kind of like a mini period, which can be pretty alarming to parents, but it's actually totally normal. It's just mom's hormones working their way out. So don't try to scrub off the discharge or vernix in the vagina. Just gently wipe and never use soap on the vagina or the face. And I know I talked about that in the bath video, but it's one of those things that I like to remind parents of. Another big star is always check the water each time. Use the underside of your forearm because that is a more sensitive area. Our hands actually get kind of desensitized to the temperature of the water. So the underside of our forearm is a good sensitive place to use to check the temperature to make sure you're not putting your baby in water that's too hot or too cold. Okay, umbilical cord care. So parents should watch for swelling, redness at the base of the stump, purulent drainage, which means like yellow or pussy drainage, and a foul odor from the stump at each diaper change. You want to be sure to fold the upper edge of the front of the diaper down below the belly button so that the stump remains exposed and dry. The stump will probably fall off somewhere between 10 and 14 days after birth. Alright, so medications that are typically or routinely given to baby include erythromycin, vitamin K, and hepatitis B. Erythromycin is an eye ointment. It's actually an antibiotic, and it's given to reduce the chance of infection to the eyes, and that's the picture you see there is the erythromycin. Vitamin K is actually a vitamin, just like it sounds. A lot of people get confused and they think all these medications are vaccinations, and they're not. We've got an antibiotic, we've got a vitamin, vitamin K, which is for blood clotting, and then hepatitis B is an immunization, and that's part of the series. So vitamin K and hepatitis B are both shots. We give those in the leg, right in the fattiest part of the leg. We try to make sure we get to the fattiest part, even on those cute little skinny babies. Vitamin K, like I mentioned, is for blood clotting. Babies actually aren't born with a certain clotting factor, and so that's why we give vitamin K to help decrease the risk of bleeding out. And then hepatitis B is, like it says there, an immunization, which is part of a series. They get their first, usually, right after delivery, and then they continue the round with your pediatrician. It differs with each state what is required. In the state of Utah, erythromycin and vitamin K are on the list of required medications, and so if you choose not to give those medications, you'll be signing a form basically that the risks of not giving them. And then hepatitis B, you'll sign a consent form for the nurse to give it. So I guess that's if that makes sense. Erythromycin and vitamin K will be given unless you have signed a consent form not to give. Hepatitis B won't be given until you've signed a consent form to give. Okay, the newborn screening. So, the newborn screening identifies conditions that can affect a child's long-term health or survival. Early detection, diagnosis, and intervention can prevent death or disability and enable children to reach their full potential. Babies are routinely screened using a few drops of blood from the newborn's heel for certain genetic, endocrine, and metabolic disorders, and are also tested for hearing loss and critical congenital heart defects, or CCHDs, prior to discharge from a hospital or birthing center. We're going to go into those two in the next slides, the CCHD and the hearing screening. So each state runs its own newborn screening program. The conditions, if you're interested, include sickle cell disease and other hemoglobin disorders. So conditions where a child is unable to process certain nutrients such as PKU, or conditions where there is a hormonal insufficiency such as hypothyroidism. Most states screen for a standard number of conditions, but some states may screen for more. That means there are differences in the screening process and the number and types of conditions included in screening in each state. So you can look that up, according to what state you guys live in. If the results are negative or a pass, an in-range results, it means that baby's test results did not show any signs of any of the conditions included in the screening. And basically, no news is good news. If the results are positive or fell out of range result, it means that the baby's test results showed signs of one or more of the conditions included in the newborn screening, and you'll be contacted. It doesn't always mean that the baby has the condition. It just might mean that more testing is needed. Your child's pediatrician might recommend that the child get screened again or have more specific tests to diagnose a condition. All right, as promised, we're going to talk about these two separately. So, babies with a critical congenital heart defect, or CCHD, are at a significant risk of disability or death if their condition is not diagnosed soon after birth. This is why we do it. Newborn screening using a pulse oximetry can identify some infants with a CCHD before they show signs of the condition, which is great. Once identified, babies with a CCHD, or critical congenital heart defect, can be seen by cardiologists, which are doctors that know a lot about the heart, and they can receive special care and treatment that can prevent disability and death in early life. So this is a super important screening. The hearing screening is a test to tell if the baby might have hearing loss. Hearing screening is easy and not painful. In fact, babies are often asleep and they sleep right through it while being screened. It takes a really short amount of time, usually only a few minutes. If your infant doesn't pass right away, don't panic. Sometimes amniotic fluid is still working their way out and it can affect the screening. Usually, if this is the case, your baby will pass at a follow-up appointment in about a week. Babies who don't pass should have a full hearing test by 3 months and sometimes also at 6 months of age to confirm if there is a hearing loss. So something that I wanted to also point out that I've written down there on the bottom is you can request to go with your baby for these tests if you'd like, or you can stay in your room and get some sleep and get some rest. So it's up to you whether you feel like you can leave your baby or not, or you can just send your support person to go with the baby while you rest, shower, or whatever it is, eat, whatever it is you need to do. All right, circumcision, it's obviously an optional procedure. It can be done at the hospital or at the pediatrician's office. So check with your insurance. It's often billed differently and can be cheaper if it's done in an office versus at the hospital. So that's something you're going to want to look into if you're having a boy and deciding to circumcise. Let's talk a little bit about circumcision. So boys are born with a hood of skin called the foreskin, covering the head or glands of the penis. In circumcision, the foreskin is removed to expose the head of the penis. It's a quick procedure that causes very little bleeding, and stitches aren't needed. Older boys can be circumcised, but the procedure is a bit more involved. After their circumcision, a protective bandage may be placed over the wound, which generally heals on its own within a week to 10 days. Depending on the type of circumcision, a bandage may be used or not. So here I've just written, the forms of pain management. So lidocaine is a centralized anesthetic that will numb the area. And then cherry syrup is given to the infant on a binky, and they love it, and it makes them happy. So we just dip a little bit of cherry syrup on the tip of that binky for them to suck on. Sucking is one of the main ways of comfort for a newborn. The most common types of circumcision is a Gomco or a Plastibell, and it's just pediatrician preference on what they prefer to do. All right, I did want to include those types of circumcisions and kind of give you an idea of what they look like and some aftercare instructions. So with a Gomco, you're going to want to keep the area clean and apply petroleum jelly to diapers for the next 2 days at least. Your pediatrician will direct you on giving Tylenol if your infant is able to take Tylenol. Oftentimes, if they're young enough, they don't need it. They just need a binky or a nurse, and they're happy. A Plastibell, you're going to want to keep the area clean and dry, and there's no need for petroleum jelly. Some important things to keep in mind is to observe the penis for bleeding and adequate urination. So you want to make sure that they're still having wet diapers. Cleanse the penis with warm water and apply the diaper loosely. You shouldn't use soap or commercial cleansing wipes until the circumcision has healed, so about 5 or 6 days later. So if you need to wipe the penis, just use a soft wipe with water on it. You may see yellow exudate on the glands after 24 hours and for the next 2 to 3 days. Do not remove it. It's actually part of the healing process. You may control minor bleeding with gentle pressure from a sterile gauze pad. You should be sent home with a few of those. And if bleeding continues, or if you notice redness, swelling, pus, or a foul odor, you should notify your provider. All right, so at the end of this course, I have provided a printable PDF that has full discharge instructions. Some of the most important things we're going to go over here. So you're going to want to follow up with your pediatrician about 2 to 3 days after discharge. They'll tell you when to follow up. And to give you an idea of when that happens, for a vaginal delivery, discharge usually happens between 24 to 48 hours post-delivery. If you're wanting to leave at the 24-hour mark, make sure you let your nurses know, because all that testing that we just talked about needs to be done before you can be discharged. And for a C-section, discharge happens on usually about day 3 to 4 post-delivery if there are no complications. So the most important part of our discharge instructions is when to call the doctor. So let's go over these one by one. So if your infant is breathing differently, slower, faster, noisier, and you're worried about it, just call the doctor. If they have a temperature above 100.1, if they're vomiting, so not just spitting up like a normal baby would, but If it's projectile or green and there's a large amount coming out frequently, you're going to want to call. If they're refusing food several times in a row and not producing wet diapers. Excessive crying, meaning they can't be consoled. Listlessness or lethargy, so they're limp and unresponsive. Loose, runny stool, mucus, blood, or a foul odor. This means this is all relating to a diaper. So if their stool is all of a sudden runny, mucousy, bloody, or has a foul odor. If they get an unusual rash or change in the color of skin. So, for example, suddenly looking orange or tan, they may have an issue with their bilirubin levels. In other words, they could be jaundiced. You're going to want to call your doctor. And then obviously down there at the bottom, if your baby's blue, call 911 immediately. And we're going to talk about CPR. We actually have a great video on that to help you guys feel confident and know what to do if that were to happen to you. All right, so miscellaneous. We've got some fun things about the hospital and also some great videos at the end here. What to bring to the hospital for your baby. This is so fun to pack your hospital bag with all those tiny, cute little things. First thing, make sure you have washed all your baby's clothes. Like we talked about, newborn skin can be really sensitive, so it's important to have their going home outfit at least washed and a blanket washed for them before they go home. So the first thing on the list, an outfit to go home in. So an example of that would be a onesie with mittens. If the onesie doesn't include those mittens, which is that kind of pulls over their hands, you're going to want to get some mittens, or actually the newborn socks can work to put over their hands. Like we talked about in the newborn assessment and bath video, their fingernails are actually connected to their skin at this time. And so we don't want to clip it, or you could risk clipping their skin and then bleeding because they're still attached. So you can file them down if they're really long, or just keep them covered so they don't scratch their face. You're going to want to have socks for their feet and then a hat, depending on the time of year. If it's summer, you might not need, all that stuff, but you want to make sure they're covered and warm enough for that ride home. You're going to need to bring a car seat to the hospital. Your nurse is going to check and make sure the baby is clicked into the car seat correctly. However, there's liability issues if the nurse installs the car seat into the car, so make sure you know how to do that before you leave. Depending on where you buy your car seat, if you buy it from like Bye Bye Baby or Babies R Us, usually somebody working there can show you how to install it into your car correctly. A swaddle blanket for the car ride home, or if you want to, put them in a blanket at the hospital, that's yours. You can do that as well. They'll have blankets at the hospital, but you're going to want your own for the car ride home. Some mothers prefer using a boppy for breastfeeding. Personally, I was able to just use pillows, and so I didn't bring a boppy. It might be something that you want to just have in the car in case you're like, okay, I want to use that boppy, and you can send your support person down to the car to bring up to the room. And then here's that star, that glorious star at the end there. We've got diapers, wipes, baby lotion, a brush, baby oil, formula, bulb syringe. All of this is provided at the hospital, so you don't need to worry about packing any of that stuff. However, when you leave the hospital, be sure to grab any diapers that are in the room or wipes, whatever they've brought into the room. It can't be reused. It just gets thrown away. So check with your nurse to be sure that you're good to take those things home. But usually the hospital will actually send you home with even more diapers and wipes. So any of that stuff that they've given you, you're usually clear to bring home. And then I put down there at the bottom that a checklist for mom on what mom needs to bring is included in our childbirth course. So you're going to want to check that out. All right, and then here are just some good rules to pass on to your family and friends. You can tell them your nurse gave you these rules to follow when it comes to visitors. Just blame your nurse. Nurses are more than happy to take the blame. This is also a good, little slide if you wanted to just send it to your family in an email, just say it came from your newborn course. So let's talk about these. Some good rules to consider for visitors. Number 1, always wash your hands before holding baby or use hand sanitizer. Hand washing is the number 1 defense against spreading the infection. Number 2, give plenty of notice and ask if it is okay that you visit. There's nothing worse than having someone show up at your door and you're unprepared, you're feeding baby, you're not dressed, whatever it is, you're going to want some notice before people come. Number 3, absolutely no one who has been sick in the past week or had children sick or anybody in their family in the past 3 days is allowed to visit baby. Number 4, please refrain from kissing baby. We don't want to spread germs. This is something that you can take out. I know every family is different on this, but as far as a germ standpoint, I would recommend not having anybody kiss your baby but you. Number 5, young children should stay at home. New moms need a low-stress environment, and kids also bring germs. So I think this is really important. The hospital for sure, and also when they come into your home, just have the adults come. You'll have more fun because you'll be able to talk to the mom, and also you're not going to be worried about entertaining a child or having them get into your stuff. Depending on the hospital or birthing center, there's actually certain times of year that they don't even allow children to come visit because of RSV and flu season. So that's something to keep in mind, or you could even use as a good excuse if you're delivering, in the winter months, that they won't allow children because of RSV season. Same with letting them into your home. Number 6, keep visits short in the first few weeks. Mom might need to pump or sleep, and that is your cue to leave. Give mom some privacy, especially because breastfeeding and, pumping or whatever it is can be stressful, and you're going to probably want your privacy. And of course, sleep is so important for recovery, for your mental health and emotional stability. So don't feel like you need to accommodate anyone. This is your time, and your time to be a little bit more selfish.